1% of America's population living in long-term care facilities. Those there actually account for 37% of COVID-19 deaths, according to COVID Data Tracking Project. That's just one aspect of the pandemic's impact. As KQ2's Madeline McLean speaking to a local advocate of residents in long-term care about what she says are her biggest concerns.
Analysis of federal data shows that more than 30% of the 520 Northwest nursing home resident deaths were caused by COVID-19.
One administrator that told me that, the resident was fine, had COVID, and then they just went in there and checked on them and they were gone.
10 months into the pandemic, Becky Caldwell, a local advocate, says long-term care facilities still haven't found the right balance
between, protecting them from the COVID versus being able to make sure that their spiritual and emotional and physical needs are being met.
No age group has been spared the mental and emotional strain of the pandemic, something that mental health experts have noted before.
There's just a lot more stress, a lot less access to care for a lot of individuals, and life is obviously very, very different now than it was, a year ago.
The residents in long-term care are in a unique situation. These facilities have been in a perpetual lockdown for months.
I've heard residents say that they would rather die because they feel like they're in prison because they can't have contact with their families.
She says she's worried families and residents don't even realize she's around to help.
People don't know that there might be an avenue for them to get in and see their family. And I would certainly advocate for that. Or if maybe their food is cold and they're not contacting us, the people that don't have any family, they got to contact us so we can try and help them.
Reporting, Madeline McLean, KQ2 News.
Caldwell says if you're a resident or a family member of a resident who needs help, you can call her office at 816-749-0034. Young at Heart Resources is also looking for volunteers to come in 2 to 4 hours a week to advocate for the residents.